Welcome back to our discussion on promoting interdisciplinary care at the intersection of faith and neuroscience. I'm Dr. Leonard Matheson. Today we're going to be focusing on the client-centered interdisciplinary treatment plan, which is the third section of the CPA Baseline Report. Now, why have a client-centered plan? I use this with approximately 65% of my clients, people who are more complex, who've had prior counseling failures, or who have lower quality of life. I find that I'm more successful when I use a formal plan in terms of helping the client stick with the program and get to the goals that we set together. I call it client-centered for a reason. It really is distinguished from the doctor-patient type of treatment program that assumes compliance to a program that the physician prescribes. Research demonstrates that actual compliance rates for these kinds of programs are less than 30%, even in the best programs. As an alternative, the client-centered approach improves compliance with the client's commitment to a mutually developed program. With client-centered participation, we have compliance rates above 70% quite typically. The client-centered approach improves collaboration between the client and the counselor. This engenders mutual respect and trust based on the relationship rather than a controlling approach to the counseling process. Why call it interdisciplinary? Well, we really do need more than one professional's perspective and more than one professional's skills when we work with complex clients. And recently, the Affordable Care Act has begun to incentivize interdisciplinary communication. Many of the insurance carriers are getting behind this and actually going beyond incentivization. When I have clients that are with me for longer periods of time, more complex clients, it's not unusual to be audited by the insurance carrier. And an important part of the audit is to ask to what degree and whether or not I have communicated with other treaters that are involved with this person. Have I made referrals, or if the person had other treaters involved, have I reached out to communicate with these people? The lone wolf counselor is soon to be extinct. At this point, the lone wolf counselor is endangered, but we really need to get beyond just working as individuals in a silo and communicate with colleagues that are working with our client. And why plan? Well, it's really important to have a formal plan with more complex clients because we really need to fit within the client's story. They've got a story that's already going on. And putting a plan together like this maps counseling into the client's story. The client's story is already underway, and a plan will help to map counseling into this next chapter of the client's story. Counseling is not a natural sort of activity for people to be involved in. And if we can lay out a plan, that's going to help the client justify to herself that the involvement with a counselor is an important part and a helpful part of developing a really good next chapter of their story. And this can really be looked at as a new chapter in the life of the client in which we are an editor, a concerned and friendly inquisitor, a coach, a confidant, and an encourager. All of these come together. All of these are different hats that we wear to help really move the client into a new chapter of their life in which quality of life is really emphasized and able to be achieved. And so this is the outline of the basic interdisciplinary treatment plan that you'll find on Section 3 of the CPA report. It really begins with and needs to begin with focusing on motivation and the client's reasons for counseling. Now, you'll start to pick this up from the very first contact with the client, but you really need to continue to develop this because we want to bring to clarity what the motivation is, what the rationale is for the person's participation in counseling. We want to ask about current service providers, people that they're working with already. Might be a physician, it might be a pastor. We want to ask about that. We're interested in the person's current prescription medications and over-the-counter supplements. We also want to ask about what prescriptions the person has received and hasn't filled, and to what degree the person is actually sticking with the medication regimen that has been prescribed. Over-the-counter supplements is an important area to pay attention to, and I include in here things that you might not consider supplements, but I do. For instance, the amount of caffeine the person uses, the degree to which and the pattern of their use of alcohol, and also now a focus on marijuana. People are much more accepting now of the use of marijuana, and I think it really is an impediment to a good counseling program, and I need to ask about that. And we can talk about how I handle that in more detail later. I'm also interested in looking at prior counseling experiences, and in this area, if it's been a counseling failure before, I want to sensitively ask and try to find out how much the client takes responsibility for that or pushes it off to the counselor as the counselor's failure, because that may well be the kind of thing that would happen with us if I'm not paying attention to that. And now we get into treatment options, and I don't want to go by this quickly with the client. There are many, many options that each of us can offer. To the degree that we've got more experience, we've got more treatment options. I don't want the client to go very far in my interaction with her before she begins to realize that I've got different sorts of things that I can offer to help. Allied with that are lifestyle options. We really need to align treatment options with lifestyle options because for almost every client, at least a small tweak of their lifestyle is necessary. And for many clients, it's not just a small tweak, it's a major change. The treatment and lifestyle options together are the guts or the core of our intervention program over the weeks and months to come. And then we get to termination targets, and this is really crucial. A lot of young counselors miss this. Without having termination targets, people tend to terminate early. If we have termination targets that are based upon the person's motivation and reason for counseling, then we've got more of a likelihood to have the client stick with the counseling program and to complete it. Remember that people really don't want to get better, they just want to feel better. And people who start counseling in pain, and as they go through the counseling process, the pain dissipates and they begin to have more self-confidence and more personal agency, may well terminate early before they've got themselves established in their new lifestyle and their new skills. And so having termination targets identified as we get started is a real good way to increase the likelihood the person will stick with the program to get lasting change. And then finally, we need to take a look with the client at the psychological necessity for participating in the program. The area that this comes up most often as an issue with is marital counseling and family therapy. The client may not realize that marital counseling and family therapy are not covered by health insurance. Now, even if you're not a health insurance provider, the client will want to either apply for out-of-network coverage or be able to apply their expense to you against their deductible for their health insurance. And it's here that we're going to be able to help the client if we talk about the psychological necessity in terms of the psychodiagnosis that we're going to offer. The psychological diagnosis using the DSM-5 is necessary for the carrier to accept justification for services. And the next section in the CPA report provides likely diagnostic codes for what we're going to get into, and we'll deal with that in a later video. So altogether, this is the outline for the interdisciplinary treatment plan that I use. I find that it's very helpful for about 2/3 of my clients, and I use it for them. And the basic focus is on helping us to get a really good start in our counseling experience with the client, and to help the client realize that life is an adventure that they can be confident in being able to get into and have really an excellent journey. They're going to get started with us, but they're going to go on way over the horizon by working with us over the next few weeks and months. So thank you for your attention to this, and please get in touch with us. Remember that we've got a free trial available. Contact us at faithfulbrain.com to set that up. Take care now.